My name is Bonnie Vandermeulen, Training Coordinator for Wisconsin Facets. Today our webinar is on the Wisconsin Promise, and a brief description of our webinar is as follows. Wisconsin Promise is for teenagers receiving supplemental social security income, or SSI, and their families. Wisconsin Promise helps youth and their family members reach their school and work goals, get job training, and prepare for the future, and earn more money while still receiving needed supports. This presentation explains what the Wisconsin Promise Grant is, who it is for, how youth and families can enroll, and what Wisconsin Promise has already learned about needed services and supports. I am very happy today to introduce to you Ellie Hartman from the Department of Workforce Development. She is a senior scientist at the University of Wisconsin Stout Vocational Rehabilitation Institute and spends 100% of her time as the project manager for the Wisconsin Promise Grant. We are very pleased today to have Ellie present our webinar to you. Ellie?
Thank you, Bonnie. I'm glad to be here. I got to do this about 6 months ago, and it's great to give an update, especially with the enrollment deadline for Wisconsin Promise coming up late April, which I'll talk about a little bit more. So I wanted to make sure that everyone had the information about Wisconsin Promise given this upcoming enrollment deadline that's coming up. So thank you for that introduction. Wisconsin Promise is about innovation, collaboration, and independence. And here on this slide, you'll see a link to our website, promisewi.com. So if you're interested in seeing more, I'll be sharing several links from our website as we're going through. There's a lot of information right on our website, including how to enroll, different stories about what's happening in Promise, blogs and resources, all kinds of things right on our website, contact information for staff and things like that. So what is Promise? Promise is a federal research grant aimed to improve the education and career outcomes of low-income children with disabilities, specifically, as Bonnie mentioned, receiving supplemental security income, or SSI. And it really, it's not only to achieve those outcomes, but to do so by fostering interagency collaboration at both the federal and the state levels to improve the services and drive innovation. So it's not being done in a vacuum. It's the collaboration of existing services and supports with some added benefits with it. Really, the feds and the state partners are really interested in finding out what can we do to change what's happening right now. Many youth receiving SSI are very likely to continue to be receiving disability benefits into adulthood, less likely to work and things like that, and really wanting to change those outcomes, that trajectory for both the youth and their family members. So they're serious about this. It's a $32.5 million grant for a 5-year demonstration. So we started back in October of 2013 and going through the end of September of 2018. As I mentioned, it's a federal and state partnership. The grant to the states, Wisconsin's one of 6, I'll show those in a bit, is from the Department of Education in partnership with the Social Security Administration, who's doing the evaluation of this grant. And then also in partnership with the Department of Labor and the Department of Health and Human Services. And then each state has the same partnerships at the state level. Here are the different states. You'll see Wisconsin Promise on there. There's also Promise in Maryland, Arkansas, California, New York, and then Aspire, which is a consortium of 6 states out west, so Utah, the Dakotas, Montana, Arizona, and Colorado. So why youth receiving SSI and their families? Consistently, the research is showing that a significant number of youth receiving SSI have low outcomes in education, employment, and financial self-sufficiency, despite the many services and supports available at the state level. Parents and families of many youth receiving SSI also face similar types of problems with low educational attainment, employment rates, low post-secondary and voc rehab enrollment rates. So despite the services available at the state level, we're seeing these outcomes, and so we're really looking at what can we do to change that. And I'm going to talk more about what we're finding out through Promise. I wanted to explain Wisconsin Promise, the basics of it, especially for those interested in enrolling or sharing the information with youth or families who are eligible or you think might be eligible. As I mentioned, it's federal demonstration research grant from the Department of Ed. We are now enrolling, so when youth enroll, they are 14, 15, or 16 years old and receiving supplemental income, SSI, so they're in payment status. That's how old they are when they enroll. We continue to work with them even as they get older, even if they no longer receive SSI, but that's the requirement to enroll. And then they have to enroll before April 30th of this year, 2016. When we enroll youth, we actually also enroll their family members, and that means at least one parent or guardian who signs the consent with the youth, but also other family members 15 and older who are interested in participating, because we provide services both to the youth and the family. When they enroll, they receive a $30 gift card. Half who enroll will receive services as usual. So when they enroll, they have a Promise intake coordinator who meets with them, gives them the $30 gift card, and explains what are the usual services that are available to them. We find many families who may be disengaged with the usual services, so just letting them know what's available and how they can connect to those services. So that's what happens if you're in usual services. The other half who enroll receive access to Wisconsin Promise services. So when they enroll, they are automatically assigned a Wisconsin Promise Division of Vocational Rehabilitation, DVR, counselor. So they're assigned to a counselor in DVR, and they immediately contact the youth and family to tell them about Promise and start services going for both the youth and the family members. Part of the services does include an electronic tablet. Most pick an iPad. There's a Samsung option available if they're interested in that, but most of them choosing an iPad. And the reason for that is because some of our services and information is available online, so we want to make sure all youth and families have access to that. They also get at least a year of a data plan in order to access those things. And that can be extended longer if there's a need. A lot of our youth and families find Wi-Fi is sufficient, but there's times when a data plan makes sense. So we work with the family to make sure that they're still accessing all our online resources. What are the services? This is in DVR. One of the main things, one main focuses of this grant is work. Getting that paid work experience while still in high school, at least one, preferably two, while in the grant. And not only for the youth, but also family members, helping connect them to jobs. Career exploration and planning, job development and placement, and other job supports, just like you could get through regular VR. They have access to all those things in Promise, and because we're enrolling youth as young as 14, often youth are getting this at an earlier age than is typical. Work incentive benefits counseling. So really talking to the families about how can work and increase their overall income and continue to access needed benefits like health insurance. So we're working a lot with families on that, and I'll talk more about that later, but a key component really helping families know what impact and we do that as a consultation, so really meeting the family where they're at, helping them understand their current benefits, any reporting that they need to do, any overpayments that they might have. We even had one family who actually was eligible for benefits that they weren't accessing, so we helped them gain access to benefits they were eligible for. They stopped receiving SSI and food stamps, and that they were actually eligible for both those things, so help with that piece, but really ultimately working with the family to how do we increase that overall income without compromising needed health insurance, of course, but how can we help the family increase that overall income. We've actually had a couple families who found that as the parents work more and they gain their income and they zero out that SSI check, they find that accessing Medicaid through Katie Beckett actually makes more sense than to do it through SSI. So they are no longer on SSI, still receiving Medicaid for the youth through Katie Beckett, and then their overall income to the household is higher. So working things like that out. Also financial training and coaching. So the families meet with a financial coach, talk about saving, talk about spending, and then they're connected to an individual development count, an IDA, where the youth comes up with a plan, a savings goal for something that will help them with their education or career goals. I'll give an example of a youth who just met her goal. She has cystic fibrosis, and so in and out of the hospital a lot, and she really wants to be a photographer. Well, that's something you can work on in a variety of settings, including in the hospital room. So her goal was to purchase a camera and photography equipment. So she saved. She could save up to, and I don't remember the exact amount, but she can save up to $1,000, and then we'll match that dollar for dollar, so for up to $2,000 to spend on that savings goal. It is a custodial account, so it doesn't impact the SSI, and they're able to save and receive that matched benefit for that saving. So that's a big piece of promise, because it's not only about increasing education and employment, but also overall financial self-sufficiency of the youth and the family. And then to help with their progress towards those goals, we also provide social skills training. And we're specifically using the Department of Labor Skills to Pay the Bills training, which really focuses on those skills that employers have said through research that they really want and are looking for with youth. So working on those skills. We have an adult version as well in case family members also want that. But working with youth in small groups, working on these different skills. There's 6 different skills, and they practice them. And then we also have self-advocacy training for the youth. It's online that they do along with the support person. And then family advocacy training or coaching, where it provides the family with information about transition, about employment possibilities for youth. And originally it was done more in a training setting, and we're finding our families really more benefit from that one-to-one interaction. So now we are in the process, actually, and there's a link on our website. I forgot to put it here, but of hiring family advocates for Wisconsin Promise. It's a position, it's a contract through BPDD through Wiseman. So the position's actually through Wiseman. We'll have the equivalent of 7 position FTEs across the state, but they could be part-time or full-time. to make up that amount. So there's a currently recruiting for that position. So if people have questions about that or want more information and can't find it on the website, please let me know. But we're actually currently recruiting for that position so that they're available come March and April to start working on with the families one-on-one. The Board for People with Developmental Disabilities, or BPDD, has provided the training and some of this one-on-one with a small number of families, and we're just going to expand that to reach more families. If it's needed, we'll provide it now, but this will really help our capacity and allow us to do this more one-on-one rather than in that group training setting that we've used in other studies, like the Let's Get to Work grant or Medicaid infrastructure grant, where they found the group training worked great and families came, and we really saw a change in knowledge and expectations. But what we find with the Promise families is the need to really meet them where they're at, what they're doing now, and meet more one-on-one, and we want to respond. And as I mentioned, the services are available to both the youth and the family, so that's a unique part of Promise, where we're not only serving the youth but also their family. And the other piece, as I mentioned before, it's collaboration. So it's not only about providing those services, but also connecting the youth and the family members to other services available. So connecting with the schools around the individual education plan, or connecting the schools in other ways if the youth doesn't have an IEP. Connecting youth and family members to mental health programs, long-term care programs, child welfare, connecting with juvenile justice. We have some youth in the juvenile justice system, so connecting and working with them as well to support the youth and the families. So we're finding, and I'll get into this, but a lot of youth and families very disconnected to systems and supports, including schools. So working with them to help reconnect them, and working with the partners to do that in a collaborative way. There's more information about Promise. We'll get into more of the details later in this, but I like to share where our information is at our website. Service information, we have a page for that. There's a flyer you can work. There's a variety of flyers on our website. That's the easiest one to share, is available. We also have some postcards that have information on the time, the enrollment period coming up. So if people are interested in that, you can always let me know, or Erin Johnson know. So if a family member is not sure if they're eligible, they're very much encouraged to call our 1-800 number, I should say our 1-855 number, where Erin Johnson up at CISA 12 does an awesome job of getting phone calls, letting families know if they are eligible, connecting the families with a Promise Intake Coordinator, which we have Promise Intake Coordinators all over the state, and what they can do is they can meet with the family, help them fill out their enrollment materials, the consent form, the intake form, and get them up to STOUT in a timely way, which is going to be more and more important as the time for enrolling is ticking down, and I'll get into that. But here's our number, and I will say it because I know not everyone has PowerPoint in front of them. It's also on our website, which is promisewi.com. The number is 1-855-480-5618. And Erin also has an email that's available on the website if folks prefer to send an email. And that's kind of hard to do, though. You don't want to share Social Security numbers and things like that by email, but just to inquire for information or ask her to call, email works well as well. So as I mentioned, enrollment ends soon. So the important part of this is Mathematica. So when we enroll folks, it's done through, as I mentioned, Social Security is doing the looking at the research. So as I mentioned, some are in that promise services, some are unusual services. So when we enroll, we have to enroll on a website, and Social Security has contracted with Mathematica to do the national demonstration research. And Mathematica has a website where we enter folks in who enroll, and they are randomly assigned into one group or the other. They are going to turn that system off at midnight. So it'll be available till 11:59 p.m. on April 30th, 2016, and then we will not be able to enter anyone come May. And of course, April 30th is on a Saturday. So in order to enroll someone, the people doing the enrollment for us here in Wisconsin is UW-Stout Vocational Rehabilitation Institute. So they need the materials in hand by April 28th to ensure enrollment. And on our website, and Erin can share this information as well, or a Promise Intake Coordinator can help with this, there's fax information. So to get stuff over to them more quickly, definitely encourage faxing. Snail mail works, and it will work for a small time period because we have noticed mail can take 3, 4, 5, 6 weeks. And we're not quite sure why it takes that long, but it has been taking that long. So encouraging people to first fax and then mail the originals. We have original signatures to the Stout team, and all that information is on our website. But this is, just want to remind folks, there's also a cap of 2,000 individuals who are enrolled. So right now we have enrolled 1,622. So there's 378 more slots left. So if we reach 2,000, that would be the other reason. So highly encourage folks to enroll as soon as they can. So I'll stop here and ask if people have questions. I'll get in more into details of the Promise Grant and what we're doing and what we're learning, and maybe in some more details of the process, but thought I would ask if there's any questions.
At this time, Ellie, no one has typed any questions for us, so just as a reminder to those on the line, please, if you do have a question, type it in your question box and we will be able to pass it along to Ellie. But at this time, there's none written, Ellie.
All right, then I will move on. So Wisconsin Promise, the collaboration. As I mentioned, it's an interagency collaboration. I mentioned the federal partners. So the Department of Ed, specifically the Office of Special Education Programs, is the one who provides all the states with the Promise grants, and then the evaluations through Social Security, who has contracted with Mathematica for the eval piece. The one partner I haven't mentioned yet is technical assistance. It's through AUCD, the Association of University Centers on Disabilities. So they're also technical assistants to University Centers on Disabilities. So ours in Wisconsin is Wiseman. So they are also our technical assistants. And Michael Gamble McCormick is the project manager for that, and he also helped with writing the legislation for WIOA. So it's been a great team to work with. And WIOA is the Workforce Innovation Opportunities Act, where there's requirements to focus on youth, and for DVR specifically ensuring working with school-age youth on developing and meeting employment outcomes at younger at a younger age, and having that focus at that young age. So that's where that connection is. State partners, now this is not all our state partners. Here's a smattering of them right here on, so you see Wisconsin facets, and then all our state departments. So DVR is with the Department of Workforce Development, that's the lead agency, and then we're partnering with the Wisconsin Department of Children and Families, Wisconsin Department of Health Services, and the Wisconsin Department of Public Instruction, and have folks from all of these agencies on our steering committee working together collaboratively, and then partnering with those local folks to partner. And then we have contracts with a variety of folks. I mentioned BPDD. We also work with WISP. I mentioned Stout. We're working with UW-Madison, not only at the Wiseman Center, but with the Voc Rehab program there, Whitewater, Family Voices, Wisconsin Workforce Development Association, Wisconsin Women's Business Initiative, and they do the financial coaching, and then ERIs, providing the technical assistance for our work incentive benefits counseling. Here's the structure, how we work. As I mentioned, we have a steering committee that includes work group leads and also department leads. I mentioned those from the different partners that we just talked about. We have a variety of different work groups: recruitment and enrollment, case management, work experience and careers, financial services, connections, data sharing, evaluation, communications, and training. So all those groups work on a variety of different pieces of the grant, and then interact with the steering committee. And then I myself am the project manager, serve on all these committees, and help all of them work together. And then we also have buy-in at the leadership level. So we have an executive committee that consists of the secretaries of those 4 agencies I mentioned: DWD, DHS, DCF, and DPI. And they meet quarterly. The secretaries and the superintendent come together quarterly, get updates on what's going on in Promise, provide suggestions and support for moving forward, and BPDD facilitates those conversations. And then the Governor's Committee for People with Disabilities is an advisory committee, so I meet and give them updates once a quarter. And they provide any suggestions to ensure that we continue to cover all people eligible for Promise with the variety of disabilities that they have. I mentioned we have a goal of recruiting 2,000 youth and their families into Promise. And we have roughly 6,000 who are eligible in the 2-year period, and then 1,000 are randomly assigned to Promise services, and 1,000 continue to receive usual services. We've been doing a lot of recruiting, sending enrollment packets directly to youth and families who are eligible. We've sent at least 1 enrollment packet to everyone eligible, and most people have received 2, at least 2, sometimes 3 or 4, depending on what we're doing for recruitment and enrollment, but they've all received that. We're also doing postcard mailings, and we are now on our 4th postcard, which we send to everyone eligible. And the idea behind them is, even if they throw them out, you can't help but read it as you throw it out. So whereas the packet you receive, I don't know what this is, I'm just going to toss it without even opening it or reading it. The postcard provides the information, and that has been resulting a lot in our phone calls to our toll-free number. They've been really helpful. We also have 20 to 25 recruiters on any month who are making calls to calls and texts to eligible families to let them know and have a conversation that way. And more recently, we started some door knocking campaigns, knocking on doors, talking to people, leaving door hangers if they're not there, helping them fill out the packets right there. And as I mentioned, if people call in and they want someone to help them fill out the packets, we can always provide a Promise Intake Coordinator who can help with that. And our Promise Intake Coordinators are through both WISP and Wisconsin Facets. They contract through them. Some of them are already associated with those organizations, some aren't, but their contract is with both of those. And I mentioned this process. So they fill out the consent form and the intake form. We need both of those to do the enrollment. Very important, we must have the youth's SSN and the parent's signature on the consent form in order to enroll anyone. Without that information, we cannot do an enrollment. So once we have that information, we enter that into RAS and our own intake system. And when it's in the RAS is the random assignment system, and that's a computer system that randomly assigns folks either to usual services or Promise services. And then following that, if they're in usual services, they meet with a Promise Intake Coordinator who gives them their $30 gift card and explains what those are. If they're in Promise services, then they're connected with a Promise DVR counselor. And those Promise DVR counselors have a dedicated caseload of only Promise. That's who they work with. That's their full caseload, is Promise Youth and Families. And we have 17 Promise counselors and 5 coordinators across the state, and the contact information for all of them is available on our website, including little snippets from the counselors themselves of who they are and how they work with youth and families. We have a variety of communication tools. So we have our website, as I mentioned many times. And we have a monthly newsletter, gives updates on things that are happening in Promise. So like the last one, usually we have updates on our enrollment numbers. I have some demographic information that I typically update every 100 enrolled, so that usually pops up. And then things like we had some community conversations in Racine and La Crosse, and we have one upcoming in Madison. So we like to talk about those conversations, and those are really the community members, including employers, getting together and talking about how can we increase employment for youth with disabilities in our community? What can I do as a community member? What can I do as an employer? How can we work together? And BPDD facilitates those, and we've had really good community conversations with those. So that's just an example of something highlighted in the newsletter. We highlight other things as well. We also have Facebook, Twitter, Instagram, and Tumblr. So especially for recruitment and enrollment, that's the way we get information out through social media. And then we also highlight good things that are happening, employment stories, other stories from the youth and the families, and then share different resources we find or other things that would be of interest to Promise families or our partners. We have an active calendar where we share outreach and recruitment events that help coordinate that. We did a lot of that, especially through the end of December. We're still doing a little bit, going to conferences, sharing the information, things like that. But given the enrollment deadline coming up quick, that's kind of tapered off a little bit, but definitely did a lot of outreach at the different conferences. And then on our website, if you go to promisewi.com/spread the word, you see information of the different materials we have available for people to share information about Promise. And I don't think I need to get into this too much in detail. This is just details the way the different departments have done outreach. So in DWD, for example, the regular DVR counselors, the START team, the business service consultants, the the WIA youth and job centers and others, now the WIOA. And so there's been, we're using our usual means of communications, but then through the 4 different partners. So through DPI, Sharing with Transition Improvement Grant, superintendents, special ed directors, school nurses, occupational therapists, physical therapists, speech and language therapists, guidance counselors, social workers, school psychologists, and others, and of course doing family and parent specific outreach like this through Facets and also through WISPE. And then DHS is doing similar through long-term care programs, mental health programs, Wisconsin Compass, a variety of different programs. We're sharing the information, Wraparound Milwaukee, just to name a few. And then through the Department of Children and Families, through W2 foster care, child welfare, and juvenile justice, we've shared information. So a wide outreach through the different departments. Just one example of how we're coordinating a single message together. And we have different kits and other outreach we've done to more local areas. So we've sent out mailings and information, and we have community connectors in some of our communities that do more focused outreach in local areas. So with the schools, the YMCAs, Boys and Girls Clubs, community centers, food pantries, housing authority, faith-based organization, disability-specific organizations, local medical clinics, a variety, specific youth organizations, things like that. So also doing outreach at the community and local level. In fact, we have community connectors now who just got, we got new flyer sticky pads that you can post like in laundromats or libraries or the corner store or something where you can post, you know, different things, and there's 25 sheets on there so someone could come and grab a sheet. So we're doing that as well right now. Where do eligible youth live? Well, 42% of our eligible youth and families live right in Milwaukee County. So most of them right in Milwaukee City, although there's other cities in that county. And another 10% in Racine, Kenosha, Walworth. And then another 10% in the Madison and the South Central area. So that includes the surrounding counties, not just Madison. And then 3% in the Waukesha, Ozaukee, Washington counties, 7% in the Fox Valley, 8.5% in Green Bay and Northeast area, including Sheboygan, just over 4% in the Wausau, North Central area of the state, over northwest area by Eau Claire and the surrounding area, about 4.5%. La Crosse and western Wisconsin area, 3.5%. And then Janesville, Beloit, and then southwest Wisconsin, about 5%. So that's where eligible youth live, and that's where we're enrolling folks. It's pretty, if you look where our enrollments are, it's pretty in line with where folks are eligible. So I mentioned we had 1,622 enrolled so far. We have 810 in promise services and 812 in usual services. And what this has here on the slide is links to where, how many are eligible by city. And this will include any cities that have 25 or more eligible, how many we've enrolled so far, and what's our target. So you can get that information right on that, in that document. And then if the city is not there, we have it by every county, the same information by every county. So if you're interested to see how many are eligible in my area, how many have we enrolled, how many are kind of left in my area, those documents, people typically like to look at those to really see who's eligible. Here's the enrollment demographics for the first 1,500 enrolled. I'm actually going to be updating this this week, and because we now have over 1,600 enrolled. The numbers don't change too much if you look at the percentages. They stay pretty consistent now that we have so many enrolled. If you look at primary disability type, 34% have and this is all, the primary disability type is self-reported on the intake form. So 34% with mental health or behavioral, and another 22% which is other. So this includes ADHD and often other mental health or behavioral are the folks write in the answers, and we'll have our researchers look through those more closely and classify them if they belong to some of these other categories. But sometimes autism is put in there, so there's some more developmental in that category as well, or multiple disabilities is included in that as well if a youth or family doesn't want to identify just one as a primary. Sometimes that's where the others end up. Developmental, about 31%. So those are the main disability categories that we see, although we do see others. We do have 4%, and that's 60 youth and families who have long-term illness, 3% with physical or mobility as the disability, 3% had sensory, 4% head injury or TBI, and then some who don't report. For race and ethnicity, 49% are African American, 37% white non-Hispanic, 10% Hispanic, 3% American Indian, Pacific Islander, those types of race or ethnicities. 1% other are unknown, and then less than 1% Asian, and then some not reported. The one area we do see a little bit of difference in this is in the Milwaukee area. About 78% are African American, so that's where you see, and I think it was about 8% white or non-Hispanic. So that would be the one area you see of all these demographics where you see a difference by location. Most of our youth and families speak English, 95%, some speak Spanish, 4%, and then there's about 1% who speak other languages. Consistent with those eligible for Promise, 2/3 or 67% are male, 33% are female. Most of our youth are living in single-family homes, 65%, 30% in two-parent homes, and then there's some other living situations happening. Many of our youth are reporting good, very good, or excellent overall health. So this would be the physical health status, so that's good. There's some with fair or poor health, but there's a good number self-reporting very good health or good health. Age at enrollment, we've 39% are 14 when they first enroll, 26% 15, and 35% 16. Many, because SSI is a means tested program, many households have a small amount of income, so 34% less than $10,000 for their household income. This isn't taking into account family size. 37% 10 to 25,000, and then 16% more than that, and then 13% didn't respond to that. Most of our kids have an IEP. Sometimes they don't, and there's a variety of reasons for that. One reason could be, I know there was a question on this, some of our kids are homeschooled, and so they don't necessarily have an IEP. So yes, we do work with kids who are homeschooled or receiving education in alternative settings. Really where the youth is receiving their education is not a criteria for Promise. We work with any youth 14 who at enrollment is 14, 15, 16 and receiving SSI. So most are attending traditional high school, although we have alternative schooling happening, and sometimes they enroll, they're in traditional high schools, and switch to some other options. Expect to work for pay, 64% say yes. Expect to live independently, 56% say yes. So we're having an impact, and we've got stories in a variety of places. We have a teenager who wants to work in sports, got a summer job with a local baseball team, the Mallards, Madison Mallards, and got to do a job shadow at UW Badger games because he's really interested in doing stats. So he got to watch how that was being done both at a men's and a women's game. I have a 16-year-old who was missing a lot of school, and we really worked with our school partners, our truancy officers, worked with our data partnership with Medicaid, who was able to locate the family, the youth, and work together to get the youth to start attending school on a regular basis again. Helped a mom complete her bachelor's degree. Had family with guardian issues, worked to advocate to keep the family together, locating new housing for those who have lost their current home. It seems to be a reoccurring thing that we're working with families on. And then there's some things on specific things we've worked on with benefits concerns, which I talked about. We actually have a link, promisewi.com /working hyphen highlights, and that we have some stories where we highlight different working stories. Folks are enrolling for a variety of reasons, and so it's just fun to read some of those comments. I won't get into them too much because I know we're running short on time, but the top one I think is one that really sticks in our head. It will help me be a better me. So really good insight by the youth when they're first enrolling. Another one, I felt it was a good fit for me and I could use the training and help because mom can only help so much. So that was interesting coming from a youth. And family members are reporting the benefits as well. I talked about the staffing statewide. One of the pieces we do is we document a resource team. So when we're coordinating services and supports, we make sure to record what are the different services and supports a family member has. So not only their DVR counselor, the coordinator, but other important team members. So someone from school, anyone from long-term care, mental health, work incentive benefits specialists, it doesn't have to be a paid or a professional, but really recording who's on that resource team. And it could be an existing resource team that we're recording, or it could be through, as we help the youth and family make connections, we'd be adding those folks to the resource team. So that's something that we're doing and recording. I talked about services, so I'm going to keep going. And really looking at our, sorry about that, looking at our outcomes. We have a variety of places where we have stories. So there's another link to some of our stories, but really looking to increase the household income, including the family members, higher educational attainment for both the youth and the family members, lifelong wage earners, and less reliance on public benefits. And we're looking at, doing back of the envelope calculation. Actually, Joanna Richard, the Promise Grant director for Wisconsin, was looking at this, and we found that if 100 more Wisconsin youth in the Promise Services Group compared to usual services group no longer use SSI cash benefits, those public savings will have funded the entire 5-year Wisconsin Promise Grant. So this is just the amount in SSI benefits for a lifetime. This doesn't include the incoming taxes and other benefits from having these individuals employed in the communities, just the cost of the SSI cash payments. So you can see a big impact this can make, not only to the youth and the families, but also looking at SSI. So what are we really learning with Wisconsin Promise? What are our lessons learned? And I mentioned this earlier, but really a lot of our eligible youth and families have been disconnected to those usual services. They're not connected with schools, VR, long-term care, mental health, other services and supports available to them. And so a lot of work we're doing is connecting them to existing resources, helping connect back with the school, working with the school. And this, again, is done in partnership with the schools. We're working with them on that. Connecting to needed behavioral services. So as I mentioned, a good number of youth and families are youth when they enroll, their primary disability is behavioral, mental health. And so, but what's happening is we're finding with some of them, they have gotten caught in more of a punishment-like cycle. So they're getting suspended, expelled, they're being secluded, restrained in the juvenile justice system. So one of the things that we're trying to help connect youth and families to, and the others working with them, is needed behavioral services and supports, bringing an expert, a board-certified behavior analyst or other behavioral expert to the team to really talk about what are those positive behavior support plans. And I know that's a goal of the schools already, but just trying to help bringing that extra resource to the team to make sure that we're coming up with an active plan to really change the way things are going, really increase their success in moving forward. Helping connect to long-term care and mental health services, we're finding youth and families have tried or maybe not tried, or not quite sure how to navigate the system, or when they do, if they don't respond timely or miss an appointment or don't fill out the paperwork the right way, that might be the missed opportunity to connect to those services and supports. So helping to bridge that gap and do that connection, really talking about those pieces, because in Promise it's a little different than other services and supports in that once they're enrolled, we're really looking at our engagement with all those families. It's not like people, if there's going to be additional spots open if someone disenrolls. In fact, we're looking specifically at what's our retention, how engaged are we with each and every family that enrolls in Wisconsin Promise. So we're accountable to every single family. So we are actively working to engage with them and finding that takes some really good skills and background. So we're utilizing a variety of things, including at least every 30 days we contact them and engage with them, or at least attempt to. And we're doing that for at least 2.5 years for each youth and family. And we're utilizing tools like trauma-informed care. A lot of our youth and families have experienced trauma, so utilizing what we know through trauma-informed care to help engage families. We're utilizing rapid engagement, continuing to progress with the families so they don't feel like they're doing it for nothing. We're moving forward with them. We're meeting them at where they're at their pace, but helping them to continue to move forward. And one of the main ways we're doing that is through motivational interviewing, really talking to them about what do they want to do and how they want to move forward, and utilizing their own information, what they want to help them move forward. So when we have the requirements to engage with everyone enrolled, we meet everyone. There's really no way to get kicked out of Promise. We don't say, well, you haven't engaged with us for a certain period of time, you're out. Nothing like that. We need to engage with them for at least 2.5 years. So that's a difference. Now, families can disenroll if they no longer want to be in Promise, and we've got about, I think, 3 families in Promise Services and 1 in Usual who has disenrolled, but otherwise they're in, and we're working with them actively. Here's just some more information about rapid engagement, and I want to keep moving, and motivational interviewing if folks are more interested in that piece. It's been a really beneficial piece. Utilizing the skills of listening, reflecting, and encouraging change talk, where the families determine their own plans, their own goals, and their own plans to move forward. Rather than meeting resistance with resistance or telling them the best way to do things, working with them has helped folks move forward and engage. And then we just have some outcomes. As I said, we're actively looking. 96% of our activities or contacts have been in the last 30 days. We're doing eligibility determination within 60 days, 96% of the time. 81% have had at least one face-to-face meeting. 75% of IPEs are completed within 90 days of enrollment. And then once they have the individual plan for employment or IPE, we have very active families, about 90%. And here's some more of the outcomes. I think I mentioned most of these already, but just all in one spot with our over 100 youth working and over 200 family members. All right. That is, oh, go ahead.
No, I was going to say, if anyone still has a question for Ellie, please type it in the question box at this time. Ellie, go ahead with any closing remarks.
Yeah, thanks for listening. If you have any other follow-up questions, feel free to contact me or let Bonnie know, and she can let me know. It's been great speaking with you, and if anyone has, I don't see anything being typed in, so I'm assuming people are good. But.
Well then, thank you very much, Ellie, for a wonderful and informative presentation today. This concludes our webinar. We'd like to thank everybody for joining us and remind everybody that we have at WI Facets over 100 scheduled trainings and webinars for 2016. We would encourage you to check out our website calendar and register for upcoming trainings. And please watch for your short evaluation that will be coming to you shortly after our webinar today. Have a great rest of the day, and again, thank you, Ellie, for a wonderful presentation. Thank you all.